everyone. Ready for a deep dive into maternal and child health?
We're going to cover a ton.
I know you're all interested in this stuff and probably feeling kind of overwhelmed with just how much info is out there.
It's a lot.
From like ACOG guidelines to new research papers,
Oh, yeah.
it can make your head spin.
Yeah.
But don't worry, we went through it all, and today we're bringing you the stuff that really matters, like
The good stuff.
the aha moments,
Yep.
the
Exactly.
stuff you can actually use.
Exactly. And what I think is really cool about this deep dive is we're not just like hitting the highlights.
Oh.
We're walking you through 10 key areas,
Yes.
starting even before pregnancy.
Okay, so we're going all the way back.
Back to the beginning.
Before the plus sign.
Before the plus sign, exactly.
Think of it as a journey.
Yeah.
From preconception planning to long-term well-being for both you and your child.
Exactly.
Okay, so let's actually rewind to before the plus sign on the pregnancy test. Preconception health.
Preconception.
I'm sure you already know the basics.
Yeah.
Eating well, exercising.
Right.
But did you know that taking folic acid before conception can reduce the risk of neural tube defects by up to 70%?
Huge.
That's huge.
That's powerful.
It's a preventative measure that I feel like often gets overlooked.
Yeah, absolutely. It's about laying the groundwork for a healthy pregnancy.
Yeah.
And that includes a preconception checkup,
Okay.
a chance to review medical history medications, any chronic conditions, get those immunizations up to date.
Yeah.
It's really like a proactive approach to minimizing potential risks.
So it's not just about popping prenatal vitamins. It's a deeper assessment of your overall health.
Exactly.
Now, I've seen genetic counseling and carrier screening mentioned as part of this planning stage.
Yeah.
What are your thoughts on that?
I think they could be valuable, especially if there's a family history of certain conditions.
Okay.
It's about understanding potential risks and making informed decisions, not about inducing fear.
Right.
Imagine it like this knowledge in this case is power.
Yeah.
It gives you the ability to plan ahead and potentially seek early interventions if needed.
I like that because being informed can really reduce anxiety in the long run.
Exactly.
And I've also noticed that preconception planning
Yeah.
often focuses on the mother.
Yeah,
But shouldn't partners be involved too?
absolutely. 100%.
Okay.
It's a team effort, partners' lifestyle choices.
Right.
From diet to exposure to environmental factors can impact both conception
Wow.
and the baby's health.
Okay.
Plus, having that support system in place right from the start can make a huge difference for both parents.
I love that, emphasizing that shared responsibility.
It's huge.
Now let's fast forward to that exciting moment in the first trimester.
Yes.
It's a whirlwind of changes.
Yeah.
And while everyone talks about morning sickness, the developmental leaps during this time are mind-blowing.
It's crazy what's happening.
It's amazing.
The baby's organs are forming. The neural tube is developing. And that incredible placenta is taking shape.
Yeah.
It's like witnessing the foundation of a human being being built like cell by cell.
Wow.
It's amazing.
That's so cool, but let's be real.
Yeah.
The first trimester is also notorious for those less than glamorous symptoms.
It can be tough.
Everyone talks about morning sickness, but what are some effective strategies to manage it beyond like the classic ginger tea?
Well, frequent small meals can be a lifesaver.
Okay.
Keeping your blood sugar stable can help minimize nausea.
Okay.
Also, protein plays a crucial role.
Okay.
Think nuts, yogurt, or even a hard-boiled egg.
Mm-hmm.
And if it's severe, your healthcare provider can discuss safe medication options.
All right.
There's no need to suffer in silence.
Good to know.
Yeah.
And what about those other first trimester woes, like fatigue and emotional swings?
Yeah, those are real.
Any tips on navigating those?
Rest when you can,
Right.
even if it's just short power naps.
I like that.
Yeah. Gentle exercise like prenatal yoga can boost energy, surprisingly.
Yeah.
As for the emotional roller coaster,
Yeah, that's a big one.
mindfulness techniques, meditation, and connecting with other expectant parents
Yeah.
can help you feel less alone in the experience.
The community aspect is so important,
So important.
especially during this time of just like immense change.
Yeah.
Speaking of which,
Yeah.
what are your thoughts on prenatal testing in the first trimester?
Yeah.
Procedures like neutral translucency screening can feel a bit daunting.
They can, but I think the key is having open conversations with your healthcare provider.
Okay.
They can explain the benefits and limitations of each test empowering you to make informed choices.
Yeah.
For example, nuchal translucency screening. It's an ultrasound. Helps assess the risk of chromosomal conditions in the baby.
Right.
It's about having information, not necessarily changing the course, but allowing you to prepare and plan accordingly.
So it's about having the knowledge and feeling in control, not adding unnecessary stress.
Yeah.
That's a great point. It's just about being informed.
Yeah.
Now, once you're past the first trimester, you enter a phase many consider the honeymoon period of pregnancy, the second trimester.
It often is.
Yeah.
Many women feel a surge of energy as those early symptoms subside.
Yeah.
And of course, there's that incredible milestone, feeling your baby move for the first time, what's known as quickening.
Oh, yeah.
It's a moment that truly solidifies that mother-baby connection.
I get goosebumps just thinking about it.
It's magical.
But of course, prenatal care is still crucial during this trimester, right?
Absolutely. Regular visits help monitor your health and the baby's growth. Screen for conditions like gestational diabetes.
Yeah.
This is also a good time to discuss specific exercise recommendations, not just the generic stay active.
Okay.
For example, swimming can be fantastic for relieving pressure on your joints and promoting relaxation.
So it's about tailoring your activity to your changing body and needs. And what about nutrition during the second trimester? Any specific dietary focuses?
Iron is crucial as your blood volume increases to support the baby's growth. Think leafy greens, lean meats, iron-fortified cereals.
Okay.
Calcium is another star player for bone development.
Yeah.
And don't forget DHA, an omega-3 fatty acid, which plays a vital role in brain development.
Yes.
You can find it in fatty fish like salmon, or consider a supplement if needed.
Now, this is where things get really interesting for me.
Okay.
Tell me more about the 20-week anatomy scan.
Ooh, yeah.
I've heard it's a pretty big deal.
It is. It's a detailed ultrasound that provides a window into your baby's development.
Wow.
You can see everything from tiny fingers and toes to the heart beating.
It's amazing.
It's incredibly reassuring to see your baby growing and thriving, and it also allows your healthcare provider to assess for any potential anatomical concerns.
This is like a really magical experience.
It is.
While you're enjoying that second trimester glow. It's also a good time to start planning for the postpartum period, right?
You're absolutely right.
Yep.
Think about things like childcare, your birth plan, and any support you might need after the baby arrives.
Right?
It's easy to get caught up in the excitement of pregnancy, but preparing for those early weeks with a newborn can really reduce stress and make the transition smoother.
That's a fantastic reminder. Okay, we've journeyed from preconception to the second trimester.
We have.
Now comes the home stretch.
Here we go.
The third trimester.
This is where preparation for labor and delivery takes center stage.
Okay.
Prenatal visits become more frequent
Okay.
as your provider monitors the baby's position and watches for any signs of complications.
Right.
And of course, those discomforts like back pain and swelling can become more prominent.
So I know ACOG emphasizes recognizing the signs of preterm labor,
Right.
especially during this trimester.
Yeah.
What should women be aware of?
Regular contractions before 37 weeks, a sudden gush of fluid, or any unusual vaginal bleeding are all red flags that warrant immediate contact with your healthcare provider.
So anything out of the ordinary?
Yeah, anything out of the ordinary, call.
Definitely call.
It's always better to err on the side of caution.
Absolutely. And speaking of being prepared, I know childbirth education classes are a popular recommendation for this stage. What are your thoughts on those?
They can be incredibly empowering.
Yeah.
Knowledge is power.
Yeah.
And understanding the stages of labor pain management options, different coping techniques, can really reduce anxiety and help you feel more controlled during childbirth.
It's about demystifying the process.
Yeah.
And equipping yourself with the tools to navigate it confidently.
Exactly.
And the third trimester can also be an emotional roller coaster.
Oh, yeah.
Any tips for managing the anticipation excitement and maybe even some pre-baby jitters?
Connecting with other expectant parents can be so helpful during this time. Sharing experiences, anxieties, and even those funny pregnancy moments can create a sense of camaraderie and remind you that you're not alone in this journey.
It's the community aspect again.
Always.
The power of community is so crucial, especially during times of transition.
Yeah, for sure.
Okay, we've covered a lot of ground from preconception to the third trimester.
We have.
But now let's talk about the main event, labor and delivery.
It's an experience unlike any other. And understanding the process can make it less daunting and more empowering.
Yes.
Let's break it down into those 3 key stages.
Okay, I'm ready for Labor and Delivery 101.
All right, let's do it.
Let's demystify this process.
Okay. Labor is a journey, a process that unfolds in these 3 stages. The first stage involves cervical dilation and effacement,
Okay.
where your cervix gradually opens and thins out, prepping for the baby's descent.
Oh.
This stage can be the longest, and those early contractions might feel like intense period cramps.
Okay, so that's stage 1.
Mm-hmm.
What about stage 2, the pushing stage? I've heard stories.
Stage 2 is when things get really intense. Your cervix is fully dilated, and it's time to actively work with your body to push your baby out into the world. This is where those breathing techniques and coping mechanisms you learned in childbirth class come in handy. It's physically demanding, but also incredibly empowering to feel your body doing what it's designed to do.
Wow, it sounds like an incredible feat of strength.
It is.
And then there's stage 3, the delivery of the placenta, right?
Exactly. It's often the shortest and easiest stage as the placenta detaches from the uterine wall and is expelled.
Mm-hmm.
It's like the final curtain call of labor.
So we've covered the basics of how labor progresses, but let's talk about pain management.
Okay.
There's a lot of information and sometimes even misinformation out there.
Right.
What are the key things to consider?
The beauty of modern childbirth is that there's a wide range of pain management options available, from natural coping techniques to medical interventions. The key is finding what works best for you and your individual preferences. Some women find relief through movement, hydrotherapy, or massage. Others opt for epidurals or nitrous oxide for pain relief.
So it's all about having choices and feeling in control of your birth experience, right?
Absolutely. And having a supportive birth team, whether it's your partner, a doula, or a trusted nurse, can make a world of difference. Continuous labor support has been shown to have a positive impact on both physical and emotional well-being during childbirth.
It's amazing how much support can influence the experience. Now, I know sometimes labor doesn't go exactly as planned, and interventions become necessary.
Right.
What are some of the common interventions, and how can women advocate for themselves in those situations?
It's true. Birth is unpredictable. And sometimes medical interventions like pitocin to augment contractions or even a cesarean delivery become necessary to ensure the safety of both mother and baby.
Open communication with your healthcare provider is crucial throughout the process. Don't hesitate to ask questions, express your concerns, and advocate for your preferences whenever possible. That's a great reminder. It's about being an active participant in your birth experience, even when unexpected things happen.
Exactly.
Okay, we've made it through labor and delivery. Congratulations.
You did it?
Now we enter a whole new world. The postpartum period, often called the 4th trimester.
The 4th trimester.
What exactly does that entail, and what are some of the key adjustments new mothers face?
The 4th trimester is a time of immense physical and emotional change. Your body is healing from childbirth, hormones are fluctuating wildly, and you're adjusting to life with a newborn. To be beautiful, messy, and often overwhelming experience.
I know ACOG emphasizes the importance of postpartum checkups.
Yes, they're so important.
What should women expect during these visits, and what are some key things to discuss with their healthcare provider?
Those postpartum checkups are crucial not just for physical recovery, but also for addressing emotional well-being. The first checkup usually happens within 3 weeks after delivery, followed by another at 12 weeks. These visits allow your provider to monitor your physical healing, assess for any postpartum complications, and provide support with breastfeeding or other feeding choices.
It's like a safety net, ensuring that both mom and baby are thriving. Speaking of breastfeeding, I know it's a hot topic with strong opinions on all sides.
It is.
What's your take on the breast is best debate, and what advice would you give to new mothers navigating this often complex issue?
While breast milk offers incredible nutritional and immunological benefits, it's essential to recognize that not all mothers can or choose to breastfeed. And that's perfectly okay. Fed is best, whether it's breast milk formula or a combination of both. The most important thing is that your baby is receiving nourishment, and that you as a mother feel supported and empowered in your feeding choices. Lactation consultants can be incredible resources if you're choosing to breastfeed, offering guidance and addressing any challenges you might face.
That's a really good point. It's really about finding what works best for your individual situation and not feeling pressured by societal expectations.
Right.
And speaking of expectations, I think it's important to acknowledge that the postpartum period isn't always sunshine and rainbows.
Yeah.
Sleep deprivation, hormonal fluctuations, and the sheer adjustment to parenthood can take a toll on mental health.
I think I can.
What are some things new mothers should be aware of, and what resources are available for support?
You're absolutely right. Those early weeks can be a blur of exhaustion, mixed emotions, and a steep learning curve. It's essential to normalize those feelings and to differentiate between the baby blues, which are common and usually transient, and postpartum depression or anxiety, which are more persistent and might require professional help. If you're feeling overwhelmed, struggling to bond with your baby, or experiencing thoughts of harming yourself or your child, please reach out for help. There are therapists, support groups, and even medication options that can safely be taken while breastfeeding.
It's so important to break the stigma surrounding maternal mental health and encourage women to seek help when they need it.
Absolutely.
And of course, partners and family members play a crucial role in supporting new mothers during this time.
A huge role.
What are some practical things they can do to help?
Practical support can make a world of difference. Offering to watch the baby so mom can nap or take a shower, preparing meals, doing household chores, these small acts of kindness can go a long way. And simply listening without judgment, validating her feelings, and encouraging her to seek professional help if needed can be incredibly valuable.
It really does take a village to raise a child, and that village extends beyond the immediate family to include healthcare providers, community resources, and even online support groups. Okay, we've talked about postpartum recovery, breastfeeding, and mental health. What about the practicalities of newborn care? Those first few weeks can feel like a crash course in everything, baby.
They certainly can. But remember, you don't have to be an expert overnight. It's a learning process, and you'll become more confident with each passing day. One of the most important things is to prioritize safe sleep practices. Always place your baby on their back to sleep on a firm surface and without any loose blankets or toys in the crib.
Right back to sleep. That's a message I've heard loud and clear.
Back is best.
What else should new parents keep in mind?
Don't be afraid to experiment with different soothing techniques to find what works best for your baby. Some babies love swaddling, while others prefer rocking or white noise. And remember, responsive feeding is key, whether you're breastfeeding or formula feeding. Pay attention to your baby's hunger cues and feed them on demand.
So it's all about tuning in to your baby's individual needs and responding accordingly. And I know immunizations are a big part of those early well-child visits.
Yeah, for sure.
Can you walk us through the recommended vaccine schedule and address some of the common concerns parents might have?
Absolutely. Childhood immunizations are one of the most effective ways to protect your child from serious diseases. The schedule might seem overwhelming at first, but your pediatrician will guide you through it step by step. Some of the key vaccines include those protecting against hepatitis B, rotavirus, diphtheria, tetanus pertussis, polio pneumococcal disease, and Haemophilus influenza type B. And while vaccines are rigorously tested for safety and efficacy, it's understandable for parents to have questions or concerns. Don't hesitate to discuss these with your pediatrician, who can provide evidence-based information and address any specific worries you might have.
It's so important to have open communication with your healthcare provider and to make informed decisions based on reliable information. Now let's shift gears a bit and talk about nutrition for both mothers and babies. What are some key things to keep in mind during this postpartum period and beyond?
For mothers, focusing on a balanced diet with plenty of fruits, vegetables, lean proteins, and whole grains is essential for energy and recovery. If you're breastfeeding, you'll need extra calories and nutrients, so don't be afraid to snack throughout the day. And stay hydrated. Those sleepless nights can really take a toll on your fluid levels.
So it's about nourishing your body from the inside out, especially during this time of intense physical and emotional demand. What about feeding those little ones?
Whether you're breastfeeding or formula feeding, responsive feeding is key. Pay attention to your baby's hunger cues and feed them on demand. And when it comes to introducing solids, which typically happens around 4 to 6 months of age, expose your baby to a variety of textures and flavors to help develop a diverse palate.
That makes sense. It's about creating a positive and enjoyable experience around food from the very beginning. Now, as we wrap up this section on postpartum care and early childhood, I want to touch on a topic that's often overlooked: maternal mental health. We talked about postpartum depression and anxiety earlier, but what about the long-term impact of motherhood on mental well-being?
Motherhood is a transformative experience, one that brings immense joy, but also challenges. It's essential to recognize that mental health is an ongoing journey, not just a postpartum issue. Self-care, stress management techniques, and support systems are crucial for maintaining balance and well-being throughout the parenting journey.
So it's about recognizing that it's okay to not be okay, and that seeking help is a sign of strength, not weakness.
Exactly.
And remember, those feelings of overwhelm, exhaustion, and even isolation are completely normal, especially during those early years. Connect with other mothers, find support groups, And don't hesitate to reach out to a therapist if you need professional guidance.
Exactly. And remember, you are not alone in this journey. There's a whole community of mothers out there who understand what you're going through and are ready to offer support and encouragement. Now, let's shift our focus from the immediate postpartum period to the broader landscape of maternal and child health. We've been focusing on individual choices and actions, but there's a whole system at play, right?
Absolutely. Factors like access to healthcare, socioeconomic disparities, and even cultural beliefs can have a huge impact on maternal and child health outcomes. It's like a web of interconnected influences. But what can we do to address those systemic issues and create a healthier future for mothers and children?
That's a great question. And it's one that requires a multifaceted approach. Policy and advocacy play a crucial role in shaping a healthier future for families. Think about things like paid parental leave, which can have a huge impact on both maternal mental health and infant bonding. Affordable childcare is another big one. It allows parents to return to work knowing their children are well cared for. And then there are policies aimed at addressing systemic inequities in healthcare access and quality. For example, ensuring that all women have access to culturally competent, comprehensive prenatal care, regardless of their income or background, can help reduce disparities in birth outcomes.
So it's about creating a system where everyone has the opportunity to thrive regardless of their circumstances.
Right.
What are some ways we can advocate for these policies and make our voices heard?
You, as an informed individual, have a voice. You can support organizations working to improve maternal and child health. Contact your elected officials to advocate for policies that matter to you, and even start conversations within your own community about these crucial issues. Every voice makes a difference.
I love that knowledge is power, but action is what creates change. Now let's bring it back to those everyday moments of parenthood. We've talked about the serious stuff, but what about the fun stuff? I'm a firm believer in the power of play.
Me too. Play is absolutely vital for children's development. It fosters creativity, problem-solving skills, social-emotional growth, and even physical development. Think about it. Running, jumping, climbing, all of that is building strength coordination and gross motor skills.
Yeah. Okay, so we've talked about the importance of connection to our children, our partners, and our communities.
Right.
But I think in the whirlwind of parenthood, there's one connection that can easily get lost.
It can.
And that's the connection with ourselves.
It's so true. Amidst the demands of caring for a tiny human, it's easy to put our own needs on the back burner. But neglecting self-care isn't a virtue. It's a recipe for burnout.
So true. So how do we find that balance? How do we prioritize self-care when it feels like there's barely enough time to shower?
Right.
Let alone indulge in like a spa day.
Well, it starts by recognizing that self-care isn't selfish. It's essential. Think of it as filling your own cup so you can pour from it freely.
I love that.
And it doesn't have to be grand gestures. It's often the small, everyday things that make a difference.
Give me some examples. What are those small but mighty self-care practices that can fit into a busy parent's life?
Well, it could be as simple as carving out 15 minutes in the morning for a quiet cup of coffee before the little one wakes up.
Yeah.
Or maybe a quick walk around the block while the baby naps, soaking up some sunshine and fresh air.
I like that, finding those little pockets of peace in the chaos.
Yeah, exactly. And sometimes self-care means saying no to that extra commitment or asking for help when you're feeling overwhelmed. It's about setting boundaries and honoring your own needs.
It's about giving yourself permission to prioritize your well-being, which can feel surprisingly difficult when you're in the thick of parenthood.
You're absolutely right. And one thing I often encourage parents to do is to reconnect with activities they enjoyed before having children.
Okay.
Whether it's reading a book, listening to music, or pursuing a hobby, those little sparks of joy can reignite your sense of self and bring back some much-needed energy.
So it's about rediscovering those parts of ourselves that might have been temporarily eclipsed by the demands of parenthood.
Exactly.
Yeah.
And don't underestimate the power of connecting with other adults.
Yeah.
Whether it's a mom's group, a book club, or simply a coffee date with a friend. Those adult interactions can be so rejuvenating.
It's about remembering that we're not just parents, we're also individuals with our own needs and desires.
Absolutely.
Now, throughout this whole deep dive, we've talked a lot about the science, the guidelines, the best practices of maternal and child health.
Right.
But as we wrap up, I'm wondering if there's something beyond the data that you'd like to emphasize.
That's a great point. You know, as much as we strive to be informed and make evidence-based decisions, there's also this powerful force that often gets overlooked.
Okay, what's that?
Intuition.
Yes.
That inner voice, that gut feeling that tells you what's right for your child.
I love that you brought that up. I think it's about finding that balance between knowledge and instinct.
Exactly. There's no one-size-fits-all manual for raising a child.
Right.
Every child is unique, every family is different, and every situation presents its own set of challenges and rewards.
Yeah.
So while it's important to be informed, to seek guidance from trusted sources, it's equally important to listen to that inner voice, that maternal or paternal wisdom that whispers, I know what's best for my child.
That's such a powerful message. It's about trusting ourselves,
Yeah.
embracing the messiness, and finding our own way through this incredible journey of parenthood.
You said it. And as you navigate those uncharted waters, remember that you are not alone. There's a whole community of parents out there who have been there, done that, and are ready to offer support, encouragement, and maybe even a knowing laugh or two.
It really does take a village. And on that note, I think it's time to wrap up our deep dive into the fascinating and multifaceted world of maternal and child health.
It's been an absolute pleasure exploring these topics with you.
The feeling is mutual. And to our amazing listeners, thank you for joining us on this journey. We hope you've gained some valuable insights, felt a sense of connection, and most importantly, feel empowered to create a healthy and fulfilling experience for yourself and your family.
Remember, you have the strength, the resources, and the wisdom within you to navigate this incredible adventure called parenthood.
Until next time, stay curious, stay connected, and trust your gut.